I urge my colleagues to oppose this bill. It will make our nation more vulnerable to disease, it will make our workforce less prepared for the future, and it will worsen the already unjustifiable racial health disparities that have devastated Black, brown, and other communities of color for generations. Hardly 3 years after the end of the worst global pandemic in 100 years, a pandemic that took the lives of 1 million people in America, this bill slashes the CDC funding by $1.7 billion. There is already a clear crisis of confidence in this administration's management of the CDC. This bill signals to the men and women charged with keeping our country safe from disease that they are not valued, that this administration does not believe in their mission, that science must take a back seat to the ego and the arrogance of the health secretary and the president. That's not going to make America healthy. It's going to make and keep us sick. This bill eliminates funding for domestic and international HIV/AIDS prevention entirely, a devastating disease for which there is still no widely accessible cure, and this administration has just decided to throw its hands up and walk away, turning its back on the 40 million people globally living with HIV/AIDS. We will see a surge in new cases and a catastrophic spike of upwards of $60 billion in costs to our healthcare system. That we are choosing to walk into this nightmare is a scathing indictment on this body. This bill slashes funding for the Office of Minority Health by 40%. It is an objective fact that racial minorities are more likely to get sick and not recover and less likely to receive care when they do. Cutting funding for the office that tracks this phenomenon and works to address it will not make it go away. This is a policy of willful ignorance. It is a whitewashing of health science. It is yet another example of this administration's racist disregard. Let me say that, racist disregard for anyone who is not white and wealthy. While I am heartened to see a small boost in funding for LIHEAP, I have to ask my Republican colleagues, if there is no substantial staff to administer this vital program, how exactly do we expect LIHEAP to be executed? Pretending you support LIHEAP while doing nothing to advocate for the workforce responsible for carrying it out only demonstrates that your advocacy is an inch deep. Beyond the far-reaching health repercussions, this bill proposes to cut billions from job training grants. Just as our country is poised to undergo dramatic shifts in the workforce as AI eliminates entire categories of jobs, and just when it's more important than ever to provide American workers and their families with the protection and support that they need to live fulfilling lives and meaningful lives. So while the president courts the billionaires making a killing off the AI revolution, Republicans are hanging the workers who will be displaced by this rapidly evolving technology out to dry. Eliminating funding for Youth Corps and Job Corps, adult job training, and cutting funding for Job Corps in half are all sickening examples of this distaste from this administration for everyday people's lives. At a time when technology is bringing our country quickly into the future, this bill looks backwards. It leaves us vulnerable to diseases that could otherwise be treated. It leaves us unprepared to respond to massive shifts in the labor force, and it takes us back to the whitewashed, racist health science of past generations. So I urge my colleagues to oppose this bill. I thank you, Mr. Chairman. I yield back.